Introduction. Hello, everyone. In this video, I'll be explaining COVID-19 in a simple way for those not related to the medical field to understand. Story. Introduction. In a quaint village, Eliza and Thomas shared a deep love. One autumn, Eliza began to feel unusually weary but dismissed it. As weeks passed, her fatigue worsened, turning into a persistent cough and difficulty breathing. Despite Thomas's pleas, Eliza refused to see the healer. Winter arrived, and Eliza's condition deteriorated. Thomas tried every remedy in vain. Fear spread through the village as a mysterious illness swept the area. One stormy night, Eliza's struggle intensified. In her final moments, she whispered to Thomas to stay strong. The next morning, Eliza had passed away, leaving Thomas heartbroken. The villagers, now aware of the mysterious illness's severity, supported him. Eliza's memory lived on, and Thomas honored her by sharing their story, ensuring their love and her courage were never forgotten. History of the virus. History of COVID-19. Late 2019. COVID-19 emerges in Wuhan, China, linked to a seafood market. January 2020. China reports outbreak to WHO, declaring a global health emergency. March 2020. WHO declares a pandemic. Countries implement lockdowns and travel restrictions. December 2020. First vaccines authorized. Global vaccination efforts begin. Variants and challenges. New virus variants emerge, posing ongoing control challenges. By 2022, adaptation to living with the virus, focus on vaccination and prevention, impact, significant effects on economies and healthcare, highlighting the need for global cooperation. What is COVID-19 and how is it diagnosed? What is COVID-19? COVID-19 is an infectious disease caused by the novel coronavirus SARS CoV-2. It affects the respiratory system and spreads through respiratory droplets and contaminated surfaces. Symptoms: fever, cough, shortness of breath, loss of taste or smell, fatigue, muscle aches, sore throat, congestion, nausea, vomiting, diarrhea. How is COVID-19 diagnosed? PCR tests detect virus genetic material from nasal or throat swabs. Antigen tests identify specific virus proteins from swabs, faster but less sensitive than PCR. Antibody tests detect past infection through blood samples. Diagnosis process includes testing, clinical evaluation, and sometimes imaging like X-rays. Determines infection presence and severity for appropriate management. How is COVID-19 treated? Treatment involves managing symptoms and supporting the body's response. 1. Symptomatic relief, mild cases, rest, fluids, and over-the-counter medications for fever and pain. Moderate to severe cases, hospitalization for oxygen therapy and monitoring. 2. Medications, antiviral drugs, such as remdesivir to inhibit viral replication. Anti-inflammatory drugs, like dexamethasone to reduce inflammation and improve outcomes. 3. Supportive care. Oxygen therapy, essential for maintaining adequate oxygen levels. Mechanical ventilation, if respiratory function deteriorates. Monitoring and complication management, addressing secondary infections and other complications. 4. Vaccination, critical for preventing severe illness and reducing transmission. 5. Clinical trials, ongoing research to explore new treatments and optimize current therapies. Countries with the highest mortality rate. Countries with the highest mortality rates due to COVID-19. 1. United States, around 230 deaths per 100,000 people. 2. Italy, approximately 230 deaths per 100,000 people. 3. United Kingdom, over 200 deaths per 100,000 people. 4. Russia, around 180 deaths per 100,000 people. 5. Spain, approximately 180 deaths per 100,000 people. 6. Czech Republic, over 350 deaths per 100,000 people. 7. Poland, around 250 deaths per 100,000 people. 8. Romania, approximately 270 deaths per 100,000 people. 9. Argentina, over 270 deaths per 100,000 people. 10. South Africa, around 240 deaths per 100,000 people. These countries have experienced varying levels of impact from COVID-19, influenced by factors such as healthcare infrastructure, public health measures, vaccination rates, and population demographics. Thank you. Thank you for watching. If there's anything else you'd like to know or discuss, just let me know. I'm here to help. Thank you for the conversation.